How did radical activism shape LGBTQ plus history during AIDS? Have you ever wondered how activism during the AIDS crisis changed the course of LGBTQ plus history? The 1980s marked a time when the HIV/AIDS epidemic hit queer communities hard. Many governments and institutions were slow to respond, leaving LGBTQ plus individuals to take matters into their own hands. This led to the rise of radical activism, which played a key role in demanding urgent attention and fighting stigma. As the crisis unfolded, community-based groups emerged, like the Gay Men's Health Crisis in New York City. These organizations provided essential support, information, and counseling to those affected by the disease. They filled the gaps left by government inaction, showing how grassroots efforts can make a real difference in people's lives. Activists also took a stand against harmful labels. The term GRID, which stood for Gay-Related Immune Deficiency, wrongly suggested that only gay men were affected by AIDS. This increased stigma and discrimination. By challenging such terms, activists worked to change the narrative around the disease. In 1973, activists successfully pushed for the removal of homosexuality from the American Psychiatric Association's list of mental disorders. This was a significant step in reducing stigma and advancing public acceptance, laying the groundwork for future AIDS activism. Later in the 1980s, groups like the AIDS Coalition to Unleash Power, known as ACT UP, emerged. They used direct action and public demonstrations to demand faster drug approval, better healthcare access, and increased funding for AIDS research. Their efforts were crucial in bringing attention to the urgent needs of those affected by the epidemic. Transgender activists, such as Sylvia Rivera and Marsha P. Johnson, also played vital roles during this time. They highlighted the importance of addressing the needs of all queer individuals, especially those who were often marginalized within the movement. Their contributions emphasized the need for an inclusive approach to activism. The impact of these efforts was profound. The disease was renamed from GRID to AIDS to reflect its broader impact. AIDS service organizations were established, and federal attention increased, leading to congressional hearings and advocacy for funding. Activist pressure also accelerated medical advances, including the discovery of HIV as the cause of AIDS and the opening of specialized clinics. For LGBTQ plus teens today, understanding this history is essential. It shows how community action and advocacy can challenge injustice and save lives. This history highlights the importance of standing up for health, dignity, and rights, especially in the face of stigma or neglect. Learning about these past struggles provides a supportive context for recognizing the ongoing need for inclusion, healthcare access, and fighting discrimination within and beyond LGBTQ plus communities.